Can newborn screening detect CF early? Can newborn screening detect cystic fibrosis early? The answer is yes. Newborn screening can identify cystic fibrosis, often within the first few days of life. This early detection is vital. It allows healthcare providers to start appropriate treatments and interventions before serious symptoms develop. This proactive approach can significantly improve growth, lung health, and overall outcomes for the child. In the United States and many other countries, newborn screening for cystic fibrosis is a standardized program. It typically involves a two-step process that starts with a small blood sample taken from the baby's heel shortly after birth. The first step measures a chemical called immunoreactive trypsinogen. This chemical tends to be elevated in babies with cystic fibrosis. If the immunoreactive trypsinogen level is high, the second step involves genetic testing for common mutations in the cystic fibrosis transmembrane conductance regulator gene, which is responsible for cystic fibrosis. If one or more mutations are detected, the newborn is considered screen positive. This means they will need follow-up diagnostic testing, which usually includes a sweat chloride test to confirm the diagnosis. This screening method is quite effective. It detects about 95 to 99% of newborns with cystic fibrosis, depending on the specific protocols used. However, it is important to note that false positives are common. Around 90% of screen-positive results do not lead to a cystic fibrosis diagnosis but instead identify carriers who do not have the disease themselves. False negatives can also happen, though they are less frequent. This means some babies with cystic fibrosis might not be identified immediately by screening. Therefore, clinical vigilance and further testing are essential if symptoms arise. Recent advances in newborn screening have improved the accuracy and speed of tests. New methods can detect virtually all cystic fibrosis gene mutations, which reduces the chance of misdiagnoses and allows for earlier treatment initiation. Early diagnosis through newborn screening is linked to better nutritional status, healthier lung function, and increased life expectancy for individuals with cystic fibrosis. In summary, newborn screening is an effective tool for the early detection of cystic fibrosis. It enables timely intervention that can significantly enhance health outcomes for affected infants. However, follow-up diagnostic testing is crucial to confirm the diagnosis and guide treatment. This screening is a vital part of cystic fibrosis care and is recommended for all newborns, regardless of race or ethnicity. Always consult healthcare professionals for personalized medical advice and guidance.